Dr. Beck, tell us a little bit about the connection of physical therapist and yet you're doing these nerve testings. How does that help you treating the patient with physical therapy when you first do a nerve testing, or whichever way it goes? Let us know about that.
Well, the two work very closely together. You know, the key from my standpoint is to know exactly what you're treating. If you don't know what you're treating, you always end up with the wrong treatments. And so to know whether you have a muscle injury versus a pinched nerve or nerve damage or a muscle disease, you frequently have to go through nerve testing first. For example, let's get back to the tennis elbow we were talking about. This is pain in your elbow when you grip or play tennis or golf. This can also be caused by a pinched nerve in your neck. You can get pain in the exact same location. So if you don't do the nerve testing, you don't know if it's from tennis elbow or if it's from a pinched nerve in your neck. If it's a pinched nerve in your neck, physical therapy is not going to help you at all, and you're going to waste a lot of time and energy on it when you need to be doing a completely different type of program. So that's a very classic example of what you can have two problems that seem to be very obvious, but until you do the nerve testing, you really don't know what you got on your hands.
I see. So, well, I can think with it from a, from a mechanical, level, from a mechanical engineer, but more so even from an electrical type of level. And for instance, these days, you can't bring a car to a car mechanics without him hooking it up. And funny enough, they see which nerve was pinched. They see, where there is something which puts a strain on the car which shouldn't be there. And that may be a cogwheel, that may be whatever it is, that, it shows it and say here, it overloads it. Basically, the overload came from here. And is that kind of like how a muscle from outside, as you clearly said, like the knee is hurting, and you have you have a complete different muscle. Which one was that again? Which is maybe wrong when the knee is hurting?
The thigh muscle.
The thigh muscle. So you have the thigh muscle not working. Who would think that the thigh muscle not working well or being weak has to do with your kneecap hurting? And when you sit in the car and drive a little longer and you kind of whatever. So, and instead of guessing and pushing, you go and you do a test and you go, this muscle is weak, this muscle is, and again, there are different types of muscle. There are just weak muscles, there are pinched muscles or nerves, I guess, and then there are like systemically ill nerves. And you can make the differentiation which one it is, right?
That's correct. For example, let's get back to our elbow pain. Like I said, there is one reason you could have elbow pain is tendonitis. The other is a torn muscle. Another is a pinched nerve in your elbow or a pinched nerve in your neck. And until I actually do the testing, we really don't always know what's going on. So, again, if we're addressing this as a torn tendon and it's really a pinched nerve in your neck, you're really chasing your tail and you're not going to get anywhere.
Right. Because obviously we have, and so do I think doctors, even though we know better, but we have a tendency to think the problem is where the pain is.
Exactly. And oftentimes it can come from a location far distant from where you're actually hurting.
Yeah. Because it's so, you might even be swollen where the pain is, but that doesn't mean it comes from there, right? It can come 2, 3, 10 inches away or more for that much.
Well, it can. And, for example, carpal tunnel is another syndrome that can have several different causes. They call it the double crush syndrome. You can have symptoms in your hand that look like carpal tunnel syndrome. They act like carpal tunnel syndrome. But, again, they may actually be a pinched nerve in your neck. And it could also even be coming from a muscle spasm in your shoulder. And until you actually do the nerve test, you don't know which of those locations is causing the problem.
Well, very informative. Thanks a lot. I hope that people watching this video take this to their heart and, for purpose, start off, especially if there are problems which have not gone away for a while. Tried a few things. Get a nerve test. with a person like you who can do it, and who then on top of it afterwards has ways on improving that nerve, which may be physical therapy and maybe even all the way up to surgery, but at least you know where you're cutting and why, and you know it, and you know that it won't go away without a certain treatment. Thanks a lot, Dr. Beck.